Balu, and I'm a fourth-year medical student at FIU HWCOM. I'm excited to present our project, Beyond the Incubator, Gaps in Mental Health Screening for NICU Parents. NICU parents endure much stress related to their child's health, and this stress affects them past the postpartum period. 40 to 50% experience PTSD, anxiety, and depression, greater than 7 to 17.5% in their non-NICU parent counterparts. In this research, underrepresented populations include fathers of these NICU babies who have reported 60% mild to moderate depressive symptoms. These psychiatric effects of the NICU and that trauma can have lasting effects on the family. 25% of NICU parents reported that after a year, they were still symptomatic with either PTSD, anxiety, or depression. And these have trickle-down effects, becoming a detriment to bonding with their child and the infant's development itself. Despite these problems, there's no national guideline that exists for screening NICU parents for these psychiatric symptoms. Fewer than 50% of the neonatal ICUs in America routinely screen these parents for the psychiatric issues I've mentioned. We made a systematic review to better understand NICU caregiver burden, to identify gaps in current screening practices, and highlight effective interventions that are continuing to tackle these problems head on. We created a PRISMA compliant literature review, which took papers from PubMed, PsycInfo, and Google Scholar, and that were published from 2013 to 2025. 30 of these papers met inclusion criteria, which was that they measured prevalence and persistence of anxiety, PTSD, depression in NICU caregivers. They looked at the presence or absence of structured mental health protocols, and that they stratified outcome by race, language, and socioeconomic status. We found that NICU parents demonstrated increased rates of the three measured mental health disorders compared to healthy newborn parents. Black mothers who are part of larger underserved communities and populations are more likely to have a child in a NICU due to their increased rates of preterm births and experience, on top of that, the highest rates of systemic barriers to mental health care. Parents of neonates who have passed away or suffered severe outcomes are even higher risk for PTSD and depression. Fathers and non-birthing parents are rarely screened throughout this process while they're still vulnerable to these mental health disorders. However, several intentions and interventions have showed promise with these problems. Routine validated screening tools increase detection of anxiety and depression by 20 to 30%. Telehealth follow-up reduced parent anxiety and depression by 30% after NICU discharge. Infants of these supported parents demonstrated higher earlier cognitive scores and fewer maladaptive behaviors. Embedded psychosocial staff has also shown better outcomes for the parent and the child. Our analysis reinforces the need for standardized screening to help identify and direct parents to seek and receive the help that they deserve. Despite decades of research on NICU stress, we still lack combined, validated tools that screen for depression, anxiety, PTSD, and psychological trauma in an integrated way. We recommend routine distress screening, in-unit psychosocial support, culturally responsive referrals, and development of a comprehensive screening inventory that would screen for these mental health disorders and psychological trauma. Targeted screening of NICU parents addresses a critical research gap and represents a simple intervention with the potential to yield generational benefits for both child and family. Thank you for your time.